I go to the next paper, and this is what we like. Actually, Deepa presented it, Deepa Jain. She presented it, but we all four joined in preparation of this paper. Um, in that conference, health psychology, um, two things were presented from AOH. One is this paper, and another was a symposium. Myself, Dr. Dini, Baljit, and Nivedita, we four participated in that symposium on basics of hypnotherapy. We discussed about what it is not, and what are the applications, and all those things we talked. So that symposium also went very well. And this was a paper. Especially, I'm sharing with you people because many of you participated in this survey. This was a survey paper, and most of the students who are here, past students of diploma course, they have participated in this. So I thank all of them. And this was part one of the study. We are now going to start part two of the study also, and request again to all of you to cooperate in the same way. So this is exploring the practical application of science of hypnosis by professionals in India, trained through 1 year postgraduate diploma course in clinical hypnosis. And we four people worked, Deepa, Baljit, Nivedita, and myself. Now, the science of hypnosis used to be taught to medical and psychology professionals by some experts and professional societies through a few days workshop in different parts of India till 2000. Till 2000, there used to be 3 day, 4 day, 5 day workshops by ISCH, and by there was a society in Bombay also, Dr. Athavli started it. And in different parts of the country, different experts used to carry out some workshops, and they used to teach hypnotherapy. For the first time, a structured 1 year university course was started by MS University of Baroda in year 2000. And then similar online course was started by Charotar University of Science and Technology in 2016. So these are the two courses, 1 year, one full year course in hypnosis. One is offline and another is online. After 23 years of offline course, this course of MSU, and 7 years of online teaching of clinical hypnosis by two different universities, for the first time, a follow-up study of this kind is taken up. If I go through some of the reviews, some of the similar studies carried out earlier, a survey of 201 full members of Australian Society of Clinical and Experimental Hypnosis revealed that hypnosis is widely used in treating anxiety, phobias, smoking, overweight, insomnia, enuresis, pain, migraine, depression, and nail biting. This was the report in 85. Psychologists and medical practitioners were compared on their responses, with medical practitioners emerging more in self-programming in treating patients, while psychologists focus more on patient-centered therapy. Psychologists used to carry out sessions, patient-centered sessions, while here there was more of educating the client and then self-programming. They used to teach self-hypnosis, medical people. And this was reported by Shannon. Then Alkins reported recently, 2023, in an international survey of clinicians across 31 countries regarding current practices and views of clinical hypnosis, 36 common uses of hypnosis were identified, which included stress reduction, well-being, and other applications. The most common approaches to hypnotherapy were Ericksonian hypnotic relaxation therapy and traditional hypnosis. So this is reported by Alkin. And then this is another report in 2011 by Rodolfa, a survey of 600 randomly selected members and fellow of APA, Association of Psychologists of America, general membership, members from general membership, and 288 members of the Division of Psychological Hypnosis, APA division, they call it 30 APA, division 30 of APA, yielded a total of 463 respondents, 50% and 57% respectively. So out of these 600, 50%, and out of these 288, 57%. The results indicate, Anant, okay. So the results indicated that 47% of general membership and virtually all Division 30 members, 100% of Division 30 members have had some training in hypnosis. Overall, respondents hold favorable attitude toward hypnosis as a therapeutic strategy and research tool. Over one half of Division 30 members and 9% of the general membership respondents have conducted research in hypnosis. Okay, so many people, almost 50% of these Division 30 are involved in research, while 9% of the general category members. So this was the report. And then one more study, this is again by McCann, recently published study. In a survey conducted by Society of Clinical and Experimental Hypnosis, Task Force for Efficacy Standards in Hypnosis Research revealed that clinicians reported using one or more of several different styles of hypnosis in their work. It is found that 2/3 of the clinicians used Ericksonian. And nowadays, Ericksonian is picking up. Most therapists use that, followed by hypnotic relaxation therapy and traditional hypnosis, and little use evidence-based practice. So this was reported in 23, last year only. Now, objectives of our study to explore the impact of one-year university course in clinical hypnosis taken by qualified psychology and medical professionals on use of hypnosis in their professional practice, on use of self-hypnosis for their own purposes. Then third is on their hypnosis-related teaching programs, workshops, or training if they have been conducting. And fourth is on their hypnosis-related research projects or publications. So these were the four things. The same thing, little more in detail. The areas explored in present study include percentage of professionals who are using hypnosis as an intervention in their practice after pursuing diploma course, then percentage of professionals who perceived some changes in their overall growth as a health professional after doing this course, and those who are practicing self-hypnosis for their own purposes, and then percentage of people who published hypnosis-related research papers or case studies in national or international journals, then people who publish books or chapters on hypnosis in national or international publications, and people who presented hypnosis-related research papers, case studies, or lectures in conferences. So these were the areas covered in our questionnaire. The method, sorry, it's a descriptive type of study. Sampling was done like this. It's a convenient sampling method. It was used. Out of the total 300 survey participants, 200 were approached through email and 100 were approached through WhatsApp alumni groups, alumni group of different batches, and now MSU alumni group is there, so through that, considering the busy schedule of professionals, 40% of them were reminded personally through phone calls and WhatsApp after 3 days of group communication. The participation was consensual, anonymous, and voluntary. The measures taken were the responses were collected in the form of Microsoft Excel spreadsheet, and data were analyzed using frequency distribution tables as well as computation of percentage for the elicited responses on the Google form. The procedure followed was this: an online questionnaire was prepared and circulated among the accessible participants from offline and online clinical hypnosis courses through group emails and WhatsApp group messages to seek responses from the participants. The Google form was divided into 6 sections. Section 1, a letter addressing objective of the survey. Section 2, demographic information like their name, age, gender, qualification, the training taken, and all this information. And then section 3, questions pertaining to use of hypnosis in their professional practice. 4, questions pertaining to use of self-hypnosis for themselves and any changes noticed in themselves after going through the course. And then section 5, questions pertaining to publication and presentation of hypnosis related research or case studies or chapters or lectures given. And section 6 was question pertaining to coaching of clinical hypnosis. So they are engaged in teaching it. Responses were designed in 3-way yes and no questions, MCQ, and subjective questions. The data set includes 183 respondents collected between September 5 and 13 of last year. So 183 responses we received out of 300. Out of 300, so 61% responses we got. And average age of respondents was 41.96 plus or minus 11.98. There are 33% male and 67% female respondents. This is something interesting. It is sincerity among female participants, perhaps. Of course, the course was also like more female teeth than male courses also. That is also I observed. Anyway, 8% of respondents are medical graduates, 67 are postgraduate in medical or psychology, and 23% having doctoral qualification. 28% respondents are from the offline course and 72 belong to the online, because this offline course, the MSU students were, many of them were not approachable, and my rapport with them also is not there for last few years. I have not been taking their classes and all. So maybe, but these people, we got very good response, 72%. Okay. Then 1% respondents completed hypnosis course before 2001. Matlab they did in the first batch, 2000 batch. 9% completed between 2001 and 10. 46% of respondents were from 11 to 20, that decade, and 44% completed after 20. Matlab these first 21, 22, and 23, these 3 years. So if we go to the different results, we found that 92% respondents they reported that they are using hypnosis in their intervention, in their practice of whether they are medical practitioner or psychology practitioner. Now, this probably those who are practicing, they only have responded. Many of the people have not responded. No? 63% have responded, remaining have not responded. They might be the people who are not practicing. So therefore, I want to discuss with some of the colleagues that how to find out how many are, मतलब those who are non-respondent, unko bhi approach karke we find out whether they are using it or not, or something further can be done in this, because this is what I found, that those who reported, those who responded to this, then actually they are in live contact with the science. Then we asked the reason for their using hypnosis in their practice, and we gave 4 options: that it facilitates direct access to subconscious, it gives quick result, therefore I am using, or it is easy to understand and simple to practice, therefore I am practicing, or it is scientific and effective. So 71% choose this response, and 14% this response. Very few for this quick result, you know. So this was something interesting. Then professional practicing hypnosis prior to their joining diploma course. Some 20% were already practicing hypnosis. They have learned it. They learned it through some workshops or other individual training. But 80% it was for the first time they were learning it. Then professionals who took additional training of hypnosis in hypnosis after completing PG diploma course. So we found almost 18% took some of the other advanced workshops, like past life regression workshop or some other workshop after their diploma course. Professional practicing self-hypnosis for their own purposes, that is also we found 90% of them are practicing. So this is really very, very satisfying to me, because I have been always conveying to the participants that you do it, and once if you do it regularly, then only you can become a good hypnotherapist. This is what I recommend to people, and many of them are doing it. Academic contribution by professionals in field of hypnosis. There, I have concern, because only 4% people either publish their paper or publish a case study. Of course, many of them have been doing workshops, but participation in conferences also was not much. It is for 17, 18%. Engage in coaching, teaching. Some of the teachers in psychology, they participated, so naturally they are taking it. Unpublished work is reported by 10%, but publication is by only 4% people. Then a worth noting outcome of this survey is regarding development of 3 important qualities as reported by them among the participants of a year-long clinical hypnosis training. 39% professionals felt that they became more empathetic after going through this 1-year course. 26% reported improved communication with their clients, and 10% reported developing non-judgmental approach in their dealing with the client. So this is something interesting. So it helped them in becoming a better therapist, better clinicians. So these are the 3 qualities required by us, you know. Some of the similar studies we try to relate. Outcome of this survey provided insight that will be useful for planning of future courses and development of science of clinical hypnotherapy in our country. The results showed that 92% professional practice hypnosis as an intervention in their psychology or medical practice. This finding supports the view that clinical hypnosis is an empirically supported clinical intervention. And another important point emerged from our finding is the reason for using hypnosis in their clinical practice shown by respondents. So 71% respondent indicated that because it is scientific and effective. The view found, the review found the studies provided evidence for effectiveness of hypnotherapy as a treatment to assist in reduction of pain and anxiety. This was a review article on that in 2015. And the results revealed that the respondent professionals perceived changes in their own personality and practice. This I already told. About 39% felt that they became more empathetic, 26% communication, and 10% told that their approach become non-judgmental. So these are the qualities contributed in their growth as a psychological medical professional. Um, 90% of professionals use self-hypnosis for dealing with their own problem and, and their self-growth in our study. And this study of Erica Fromm, she mentions on longitudinal study of self-hypnosis, it was observed that after the initial practice, as the subject feel more comfortable in self-hypnotic state, he spends less time worrying about failures in self-suggestion. Generally, people say that while doing self-hypnosis, I get negative thoughts, but after some initial sessions, they don't have those kind of negative thoughts and spends less time worrying about that. His ability to enter trance quickly, about that also, and they easily increases as does the fading of general reality orientation, trance depth, and absorption. So they improve in their depth of trance, what they say. And there are only few research-oriented professionals in our study. We could see among respondents who published research papers, 4%, and who published case studies in professional journals. The finding indicating the need for more research-oriented environment in our universities in general, and more specifically during the teaching of our course. This is what I think we need to improve upon. Research-oriented, more. We need to encourage people. Either we should give some, some small thesis kind of work so that they are trained in doing that. In a survey of 463 respondents from general membership of APA and members of Division 30 of APA, it was found that more than 50% of Division 30 members, which initially I read this paper, Division 30 members, and 9% of general membership have conducted research in hypnosis. So in US, they somehow they are more motivated for research. In our country, in general also, people are not more research oriented. So I think we need to emphasize on that. The conclusion of this first part of study is the results of present study reveal the remarkable impact of the one-year course in clinical hypnosis on psychology and medical professionals in terms of use of clinical hypnosis in their professional practice and use of self-hypnosis for their own growth as health professionals. At the same time, the study suggests need for research-oriented environment during their training for progress of the science of clinical hypnosis in our country. So what we recommend is, we recommend future studies in which comparison of respondents from offline and online course can be done, as well as psychology versus medical professional responses can be compared. And what we have thought in phase 2 is the study wherein we will explore the contents of the course, time allotted to theory and practical, examination style, and the need for some internship program. We don't have it in neither of the courses. We have internship kind of a program. So these are some of the things which we will be exploring in our second part of the study. So thank you. I took a lot of time, but I think it was necessary to discuss with you all these things. Thank you very much. So now, if thank you, Akanksha, for your feedback, and yes, keep coming every time. There is a lot of
Definitely.
learning. There is a lot of learning for all of us. All of us.
Yes, sir.
Thank you. Thank
Thank
you
you,
very
sir.
much. Thank you all.
Thank
We
you,
took
sir.
a little longer time. Okay, Nidhi. Bye. Bye. All the best
Thank you,
to
sir.
us.
Thank you. Thank you.
Good
Good
night.
night,
Good
everyone.
night. Good night, everyone.
Thank you,
Bye.
sir. Good night.
Good night.